going to be demonstrating how to perform a spirometry test, which is a lung function test. And this is what you would expect if you came for one of these at the surgery. Okay, so Emma, you're going to be doing some lung function tests today. I just need to know your height for the purpose of this test.
153 centimetres.
Okay, thank you. And your weight?
52 kilos.
Okay. We just need to know this so that it can work out your lung capacity and what we'd expect, okay? So we'll put your details in this machine. This is the device that will go into your mouth, okay? And there'll be a series of 6 blows, and I will demonstrate to you what to expect with these blows first, okay? So you know what to do. Before we start, you're sitting comfortably?
I am, yeah.
Yep, okay. If at any point during the test you want us to stop, you don't feel well, just let us know and we can rearrange it and do it again. Alright, so this goes in your mouth. You need to take a nice big deep breath in, bearing in mind your lungs come all the way down here. So big deep breath in, pinch your nose, and then pop the tube into your mouth with a nice tight seal, and you blow gently for as long as you can. And I will be encouraging you by saying keep going, keep going, keep going. Once you feel you've got nothing left to blow, just stop.
Okay.
Okay? Do you feel ready to give this a go? All right. Okay, bear with me. All right, in your own time. So big deep breath in, pinch your nose, and then blow down through the tube for as long as you can. That's it. Keep going, 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 as long as you can. Well done, as long as you can, as long as you can. Super. Feel okay? Yeah. Okay, another one like that, in your own time. Keep going, 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 a bit more, a bit more. Brilliant, well done. Feel okay?
Yeah, fine.
Okay, last one, just like that. Keep going, 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 a bit more, a bit more, a bit more, a bit more. Well done. Okay, now these next 3 blows are a little bit different. You don't have to pinch your nose, but I want you to give it a big, hard, fast blow. Right, so you need to get that nice big deep breath in like you did, and then it's a big, big, fast blow. Big blow. That's it, keep going, keep going, keep going. Brilliant. Well done. Okay, one like that. Big, big blow. That's it, keep going, keep going, keep going, keep going. Brilliant. Okay, last one.
Same again.
Yep. That's it, keep going, keep going, keep going, keep going, keep going. Brilliant. Well done. Do you feel okay?
Yeah, fine.
That's it. So I'm just going to save these results. And then what I'll do is I'll print off the results for you here. And then we'll send it to the GP to look at. Okay? So Emma, these are your lung function results, and we will make an appointment with the GP to discuss these results. Okay?
Thank you.
Here we have a copy of Nurse Emma's spirometry reading. Let's go through this and see if we can interpret some of the readings that have been generated. Here at the top we can see Nurse Emma's name, and below it we can see her height and her weight, and the machine's quite cleverly calculated her BMI. And from the date of birth that Emma gave, her age has been calculated as well. Now this is quite important, as peak flow reading, as spirometry readings can vary depending on the height, the weight, the age, and also the ethnicity of the person who's undergoing the test. Looking further down, we can see 3 of the blows that she performed, and the variation in the blows is quite low. We have 0%, 0% and -3%. anything for this to be suitable, the variation in two of the readings needs to be less than 5%. We can see in this case that all three are less than 5% difference, so this is pretty good. And as you can see, the machine has also even qualified the fact that there were 3 good blows. So moving on to looking at the results themselves, there are 2 areas that we need to look at when looking at spirometry. The first one is here. The FVC is the forced vital capacity. This is the amount of air that you can breathe out of your lungs after you've taken a deep breath in. So if you take a deep breath so that you can't take any more breath in, at that point your lungs are full of air and they're fully expanded. Now at that point, if you start breathing out and you carry on breathing until you can get no more air out, then the amount of air that you breathed out is the forced vital capacity, which is FVC. Now above it you can see FEV1. Now FEV1 is the forced expiratory volume in 1 second. Now this means that when you take a deep breath in again until you can take no more breath, and at that point you quickly blow out as much air as you can, then the amount of air that you blew out in the first second is the forced expiratory volume in 1 second. Now, with these results, there are normal readings that we can have. Generally, for FVC, this result here, for a male, an average is about 4.8 litres, and for a female, it's about 3.7 litres. Now here, with Nurse Emma, we can see that her reading is already above 3.7 litres, so she's got a pretty good lung capacity to start with. In terms of FEV1, her normal would be somewhere between 80 to 120%. Well, with Nurse Emma, her percentage is there at 118%, so she's already at the upper limit of normal, which signifies that she has a pretty good lung capacity. Now, when interpreting these test results, as mentioned, you want to be looking at these 2 parameters here, and using these 2, the machine works out a ratio of FEV1 over FVC. Now this is the bit that you need to look at when assessing your own lung function. The percentage of FEV1, the forced expiratory volume in 1 second, over the FVC, which is the forced vital capacity, you want that result to be more than 70%. Less than 70% suggests that you have an obstructive cause, which may be asthma, which may be COPD, bronchitis, emphysema. So that is the beginning point to see if your ratio is less than 70%. Now in this case, you can see that Nurse Emma's reading is 97%. There are conditions called restrictive lung disorders where you can get quite high percentages, but I'm sure in this case with Nurse Emma it's just generally down to good health and all the running that she does, and not necessarily any underlying lung pathology. So if it's less than 70%, there's a possibility it could be asthma. In this case it is higher than 70%, but let's assume that this was less than 70%. Now if that was the case, the next step would be to assess whether this result can be reversed to a higher reading, and what you want to do for that is a reversibility test. Now, in a reversibility test, there's a number of different ways this can be carried out. In some areas, nurses will undertake this test and provide a patient with the blue inhaler through a spacer device, usually 4 puffs, and then carry out the test again and see if that 70% has gone higher. In other cases, you can start a brown inhaler, the inhaled corticosteroids, and leave the patient on this treatment for 6 weeks, and then repeat the spirometry test and see if the result has increased. Or you can also start the patient on a 2-week course of 30 milligrams of prednisolone and see if that's improved the spirometry readings. Generally, if you get a more than 15% improvement in FEV1, which is this result here, then chances are you've got reversibility. So firstly, we would have an FEV1 over FVC of less than 70%, which you would find here, because remember, these are the percentage figures here. So looking at that, that would be less than 70%. And secondly, after you've done reversibility testing, if that percentage, which at the moment is already quite high in Nurse Emma at 120, but if that was going up by another 15%, then chances are you've got reversibility, and the likelihood is that you've got asthma. If the change is less than 15%, then it's likely that the patient has no reversibility, and is more likely to have COPD, emphysema, or bronchitis. Now, as mentioned previously, what we need to look at initially is the result of FEV1 to FVC. Now, when you look at the percentage, which would be here, in a patient with COPD, this would be less than 70%. So that's the first thing we need to do. The second thing, once we've diagnosed an element of obstruction, what we need to clarify is that obstruction reversible or not? Now, as mentioned previously, what we then do is go ahead and carry out a reversibility test, either using inhaled blue inhaler, nebulizer, or even inhaled corticosteroids or oral steroids. In a patient with COPD, the amount of change that we get in the FEV1 here will be less than 15%. So less than 15%, and that is after the test. So we've got the baseline spirometry here. You then carry out the reversibility test, and after the reversibility test is done, this result will be less than 15%. If it's more than 15%, then it's likely the patient has asthma. So we need these two parameters to diagnose COPD, and that is FEV1 over FVC of less than 70%, and also a reversibility test which shows the less than 15% variation. Now, once we've diagnosed COPD using these two, what we can do is assess the severity of the COPD using the percentage FEV1 result. Now, if the FEV1 is more than or equal to 80%, then the condition is mild. If it is less than 80%, but more than or equal to 50%, then the condition is moderate. If the condition is less than 50%, but more than or equal to 30%, the condition is severe. And if it's less than 30%, then it's very severe. So here we have the ability to diagnose COPD using the FEV1 FVC result to diagnose obstruction. We then go ahead and do a reversibility test. The reversibility test shows less than 15% variation in the FEV1 results on the 2 spirometry readings. That now confirms a diagnosis of COPD. And then you can look at the FEV1 result, which is the result here. And if it's more than 80%, the condition is mild. If it's less than 80% but more than or equal to 50%, it is moderate. If it's less than 50% but more than or equal to 30%, it's severe. And if the result of FEV1 is less than 30%, the patient's COPD is categorized as being very severe. And each of these will have a significance when we look at medication that we can use in COPD in one of the other video clips.